I was always very interested in sports. I was a collegiate athlete at Harvard. And I was actually a lacrosse goalie, which are riddled with injuries, usually being hit by the ball. And as such, I worked very closely with actually many of the physicians still here as an undergraduate. And that led me down the path towards orthopedic surgery. Being a shoulder specialist within the sports medicine department is an incredible niche where I get to work with both young patients and older patients, young athletes in high school or collegiate or even professional sports, but also a group that I find near and dear to my heart as a former fireman, what I call the occupational athlete. So firemen, policemen, EMT, first line responders, laborers, construction workers, all of these athletes have incredibly physically demanding jobs. And I use the same perspective that I use for my pro athletes to treat them. You really listen to them. What are their goals? What do they need to get back to? And develop a treatment strategy. Many of the tenets that make a sports team successful, we have adopted as a sports medicine service. My colleagues in the offices, up and down from me, we work together phenomenally. There's a lot of collaboration. There's a lot of crossover and research that we perform to try to deliver the best care that we can. The most fulfilling part of my work is almost paradoxically some of the last visits where you're clearing someone to get back to work, to get back to their sports, to back to fishing, the activities that they love. And the patient and I enter in this journey, and it can be months to years, and it's ultimately that last visit that I actually cherish the most, where I kind of set them back on their path. There's one that I look back often to, and it was a young gentleman who had a terrible shoulder injury, rotator cuff injury, at a very young age. And he came to me after seeing a number of specialists that only offered him a replacement despite being very young. And we here at MGH, a particular center, we can reconstruct rotator cuffs. And I offered that to him, and he took the leap of faith with me. And he came back for his 6-month post-op visit and told me that he was surfing and back to playing basketball, a somewhat unbelievable outcome. And we shared that moment together. It was very special.